Well, this might be the understatement of the century. You rely on your feet a lot. And when they aren't feeling up to par, you can bet that that's going to have a pretty big impact on your quality of life, which is why Dr. Cheney from Ortho Neuro is here to talk about symptoms and solutions when it comes to some common foot pain. So good to have you, doctor.
Thank you very much.
All right, so we're talking about kind of different kinds of foot pain, all kind of common issues. So I'm wondering just how many people out there are suffering from some sort of foot pain?
You know, at some point in their life, I think pretty much every adult's going to develop something. And so the interesting thing about foot pain, for me, it's all connected. And there is one root cause that kind of drives everything. And so, you know, plantar fasciitis, bunions, flat feet, pain in the ball of the foot, you know, they all are connected. And so they don't occur in isolation. And so at some point, this is going to develop with most patients. So the analogy I use is tight hamstrings. Everybody's got tight hamstrings for the most part. And that's a well-accepted thing. And the tight calf muscle, if you talk to a physical therapist, everybody's got a tight calf muscle as well. That they call it the posterior chain, the back of the leg. And so for me, that tight calf muscle drives an arch collapse that develops all these problems.
Which it's interesting to know that it's from that. A lot of people think I'm wearing heels all the time, which I'm sure can maybe aggravate it.
Well, it can accentuate it. So if you've got a heel in and you've got a calf muscle that's acting like a tether and it's too tight, you're altering the weight on the foot. And so I tell patients, I don't treat foot pain, I balance weight on the foot.
Got it. So you're using your foot better, I guess. Correct. Would be the hope.
Right.
So why are these so common? Is it because we all have feet? I mean, we're all kind of have the anatomy?
Well, we've all got feet. There's some data out there that talks about shoe wear and how it's actually allowed the intrinsic muscles in the foot, the small muscles in the foot, to almost, you know, kind of be, you know, bred out of us because we wear these shoes, and then allows things to break down predictably. And, you know, there have been many studies that have shown that these tight calf muscles are exceedingly common.
Is it genetic at all? And I had read that, and I know some people think, yeah, my mom had them, I had them, or is it?
I hear it all the time.
Yeah.
I think there probably is some genetic component, but for me, I chuckle when I hear that. And I tell them I don't think it's, the bunion itself is not genetic, or the plantar fasciitis or the flat foot. It's the what we call the tight calf or the equinus contracture that alters the weight on the foot.
That causes that.
Correct.
Okay. All right. So how do we prevent, how do we delay these conditions?
Stretch your calf muscle as much as you possibly can. So it's as simple as, you know, keeping your leg straight, leaning into the wall, and trying to stretch that muscle. So there's actually two muscles in the back of the leg that make up the Achilles. And one of them is shorter than the other. And so it starts above the knee. And so you keep your knee straight, lean into the wall, or drop your heel off a step and keep your knee straight and stretch that calf muscle.
That sounds so simple because
Very
it's
simple.
such a painful thing for so many people. Mm-hmm. So when we talk about conservative treatments, we were discussing a boot. A lot of people do things like that. Are those still used? Are there other things that people can do?
So, you know, again, for me, it's all about trying to, I tell patients it's a weight distribution problem, not a weight problem. So I'm trying to address where the weight is on the foot. So, you know, plantar fasciitis, Achilles tendonitis, that's typically just the tight calf muscle. So we stretch that out aggressively. Physical therapy, plus or minus some injections. If you've got pain in the ball of the foot or a flat foot, I'm trying to balance the weight. So I use orthotics to try to balance the weight and then subsequently treat the foot pain. And so there's a place for boots with rest, physical therapy, all those modalities. Now,
when it gets a little more severe, maybe, and I don't know, maybe the length of time that somebody's had it could come into play. Is surgery ever an option?
It is the last resort. As I tell patients, I chose orthopedics because it's not cancer, it's not heart disease. I'm dealing with pain. It's a quality of life thing. So I tell patients, if you can live with it as long as you can. And if we've failed all these other modalities, then surgery does become an option to try and balance that weight and alleviate those symptoms.
Are they often surprised when you say, because I'm surprised that you said stretch your calf muscle, that is, you know, it seems like such a simple solution for such a painful issue that can cause people such a problem with the quality of life? Well,
there's kind of two philosophies in orthopedics, that guys that subspecialize in foot and ankle surgery. And, you know, one is kind of everything occurs in isolation. And so I've actually been fortunate to train both ways. And so this one intuitively makes more sense. When I explain it to patients, it makes a lot of sense. But, you know, a lot of us wear, you know, shoes with heel lifts in them. So, yeah, it can make it feel better, but you're accentuating that problem.
Right.
Allowing it to shorten down, and then it still alters the weight.
All right, well, I am sure, obviously, you recommend a consultation if somebody has this problem. Come in, chat with someone like you that can give them some guidance as to how to get rid of these issues so you don't have to walk around in pain, because we do that all day, right?
Very good.
All right, Dr. Cheney, thank you.
Thank you.